Welcome everyone. I think everyone that we hoped to join has joined, and those that were doing some last minute registration are with us. So we're going to make a start now. Hopefully everyone can hear me clearly and can see the slideshow in front of them. If not, then by all means just send us a comment in your comment box. So welcome to this webinar. Just so you can see the faces behind the voice and voices, my name's Vashti Berry. I'm joined by my colleagues Nick Axford and Sarah Blower. There's some pretty pictures of us there so you can see who's speaking to you. And we're all three from the Social Research Unit at Dartington. We're a research charity based in Dartington, Devon, dedicated to improving outcomes for children. Just some housekeeping rules for those of you like myself for whom this may be their first webinar that they're taking part in. The webinar itself should last for approximately 1 hour. You should have a question and answer box on the right-hand side of your screen that you can use to send us comments or questions as we're going through. And Sarah is going to be on the end of that. So if there are any issues or comments or questions, then by all means use that box. This webinar will be recorded and will be available for you to download by the end of the week or into early next week, and we'll send those details through to you. This webinar is the first in a series of 6 webinars, so you should all have received an invitation to with the dates for all of those 6 webinars. And the slide in front of you now is showing what those 6 webinars will be, and that the first of these is developing intervention manuals. Just to give you some sense of what we hope to cover in this webinar, it's divided into 2 parts, what we've called the what and the how, and each part will be followed by a 15-minute discussion where we will take the questions that you're sending through to us, and the 3 of us, Sarah, Nick and I, will answer those questions. There'll also be an FAQ sheet, a frequently asked questions sheet, where if we aren't able to get to all of your questions in the discussion time, those will be collated at the end of the webinar and posted online for everyone to access. So I'm going to take part 1 of the webinar. Nick is going to take part 2, and all 3 of us will be involved in the discussion along with you. But before I start on part 1, I should say there will be concepts and issues that are raised as part of this webinar on manuals that will also be covered in later topics coming up in the later webinars, for example on logic model or fidelity. So if there are things that you feel you'd like more detail on, you can by all means send us questions on those, but they also may be things that come up in later webinars. So I'm going to start on the what, and the first thing we want to ask is what is a manual? I'm hoping you're all familiar with the idea of manuals and handbooks from everyday life. Things like car manuals, dummies guides, a recipe book or baby manuals. Basically, it's a document or book that describes something at a level of detail or a method for doing something. And programs that are replicable have a similar document that describes what they do, how they do it, who does it, and why it should work. When we talk about intervention manuals, by interventions we mean a service, a policy, or a program that is put in place to help children and families. But in this webinar, we're mostly concerned with programs. And by that we mean discrete, organized, and typically multi-component package of practices. We want to make a distinction between 2 types of documents. The first is what we'll call a program manual, and the second an implementation handbook. Program manuals are documents that include all of the things about the program that are relevant wherever or whenever the program is going to be delivered. So for example, it might be the research base that underlies the program, the desired outcomes of that program, or the logical connection between the activities and the outcomes, the target group, any relevant training or delivery materials. Too often, this is where program manuals end. The focus is restricted to the program or the curriculum. And to be effective, we know that the materials that exist need to speak to the systems that sustain the innovation longer term. So for example, health, education, social services, youth justice. We want to know, how will children be recruited to the program? Which frontline staff need to be involved, or what agencies are going to pay for it, and so forth. Without that kind of information, it's very difficult to replicate a program. So to be replicated or to thrive at scale, an innovation will need to be delivered well by agencies operating potentially hundreds or even thousands of miles from the innovator, even many years after the innovator has moved his or her attention to something else. And to that end, we use implementation handbooks. So these are the documents that describe the processes and the agreements that are necessary for replicating a program in a new context. They don't necessarily re-specify the target group or the program components unless these have been altered for the replication. Instead, they would focus on the processes and protocols that will be adopted for that particular replication. So for example, the processes for recruiting participants or monitoring fidelity. The human and financial resources that are required are also included. Sometimes one document can fulfill both purposes. So if there are projects that at the moment don't have a program manual, they could produce one document that combines all of these items. On the other hand, there'll be projects that are replicating programs that already have manuals, and these need only then develop an implementation handbook. This is important because it will specify how that program will operate in the new context. I'm going to change slide now onto why we think programs need a manual. And hopefully in front of you should see some delicious looking cakes. What value do manuals add? Well, firstly, manuals ensure that the replication is faithful to the original design, in much the same way that a recipe ensures that a cake turns out the same way each time you make it. If you were to replace flour with rice, for example, those two things wouldn't necessarily look the same. Or if you were to use half the amount of flour, those cakes wouldn't turn out the same way. To illustrate this in terms of programs, when a program's constituent parts are clear, in other words, the target group, the logic, the outcomes and activities are specified in a manual, it's more likely to replicate well in different settings or when it's delivered by different staff. So you can see here we're trying to make a link between what was your original starting program and the different replications that may take place. And this process holds even when local adaptations are made. In this slide, we're trying to indicate that people may add local nuances, the blue and the red, but ultimately the replications resemble the original program. However, if the parts aren't clearly specified, or people pick and choose what they like, replication can go wrong. And the result is that the replication looks nothing like the original program. So second, manuals add value in allowing the delivery of the program to be monitored according to some agreed protocols. When a program's clear on its activities, it's possible to develop checklists for monitoring its delivery. Third, manuals and handbooks are useful tools for training and supervising staff, because the activities, roles and responsibilities are clearly specified, but they should really replace training or technical assistance. They should really be seen as complementary to those processes. I think finally, manuals and handbooks ensure that programs are in a state where they can be successfully evaluated. It's pointless trying to evaluate the impact of a program that is unclear about who it serves, how it serves them, or why the program should even make a difference to child outcomes. So I'm shifting slides now again to thinking about who might use a manual. And I think the first thing I want to say in response to that is that these are documents to be used. So this shouldn't be something that's written and then sits on a shelf. It should be relevant and it should be able to help a number of different stakeholders. So within an organization, your frontline staff that are delivering the program will need access to quite detailed information about the program, perhaps materials such as videos, vignettes, information leaflets, and session plans. Service managers within the organization, in other words, the people in charge of running the program, will also need information about the setup of the program, who to recruit, what to monitor, and what costs to expect. Commissioners of services in local authorities or agencies, in other words, those interested in purchasing a program, will want some information about the program that allows them to compare it to similar programs or to identify if it is fit for purpose. And then finally, researchers, those evaluating the impact or process of a program, will need to know the logic model that's being tested, who it's designed to work with, and what should be delivered. Of course, each of these different audiences require different things from the manual or handbook, so the documents should enable them to access the level of detail that they need. And in the second half of this webinar, Nick's going to look at the structure of manuals and handbooks, and we'll link this to the various audiences that might access them. So far, we've highlighted all of the advantages to you on manuals and why we advocate their use. But it would be wrong to suggest that they are without critics or challenges. For starters, manuals are only as good as the content within them, and they vary in the level of detail and guidance that's provided. So it's likely that not all of the issues that delivery staff are going to face will be covered in the manual. Regular staff supervision and monitoring of program delivery will ensure that the issues related to fidelity problems are highlighted early on. Second, frontline staff may resist a manualized approach. They may feel that having a manual undermines innovation or their professional judgment by specifying rigid practices. And for this reason, we think it's really important in a manual to emphasize the role of professional judgment within the program. For example, how people decide about the appropriateness of the program for the individual, how it can be tailored for that individual, or when to review progress or try something different. We can think about two extremes of this. A teacher who faithfully, in other words, with fidelity, but rather blandly delivers a social emotional learning program to a class of children, delivering it from a script, may be as ineffective as the teacher who simply creates his own lesson to make it more exciting. Neither are delivering the program as designed. The third challenge is that some people say that manuals may not be able to address the complexity of real cases. So, for example, a reading program focusing on helping struggling readers is really unlikely to be able to address issues like poverty or domestic violence that might be related to the reading difficulties. Implementation handbooks can spell out how to link up with other services available in the area in these circumstances. And then finally, I guess there's a danger that commissioners or service managers see manuals and handbooks as cost-effective replacements for training and technical assistance and staff supervision, and this should be guarded against. We want to talk finally in this section about adaptation, and this is an often misunderstood concept, and we could probably dedicate a whole webinar to this topic alone. The key, we think, is to be clear in the manual about what can and cannot be changed in the program and why. It seems quite obvious to say it, but the success of any innovation will only be repeated if the things that make the innovation work are repeated. So success demands fidelity, and the people who are delivering that program need to know what they must do to achieve the same success. But we also know that scaling of successful innovation requires adaptation. In other words, the ability to mold the program to fit with local context and a scope for those people who are replicating it to make it their own. So success, therefore, demands not only fidelity, but also versatility. We think we can make a helpful distinction between two kinds of adaptation. Adaptation to the surface structure of a program and to its deep structure. Surface adaptation really refers to the changes that are made to ensure that programs fit and flourish in a new setting. So this type of adaptation really avoids modifying core components and really tries to preserve the underlying theory. So for example, it might involve making language more culturally relevant, using different colloquialisms and examples, and it might entail recognizing what is accepted or undesirable behavior in a new context. Changes to deep structure are more controversial. These involve making significant changes to the logic underpinning the program or its components. So if we had a program that and this is a basic logic model, had a logic model that said in order to move from A to C, you would go via B, a change in the logic would mean that you would no longer be going through B, but you'd be going through D. These kind of adaptations should only be pursued if there's strong evidence that that logic model needs to change. In other words, evidence that actually you can get to from A to C via D. And they should always be done working closely with the program developer. Ideally, they would also be tested in a rigorous evaluation. An example of some deep changes are perhaps enhanced versions of some parenting programs like Incredible Years or Triple P that have been adapted to support parents of children with autism. There is empirical evidence that working with these families in a different way will address behavioral problems. We're going to move on now to our discussion section. And I know Sarah has been collating some questions behind the scenes for us to answer. So we'll take one of the first few questions. By all means, if you've got others, please keep on sending them through.
Hi everybody, it's Sarah here, and thank you all for submitting some questions. I know that a couple of you have experienced some technical problems where you haven't been able to access the questions panel on the side of your screen. If you would like to email some questions through to Laura, whose email address you should have, she sent the email with the link for the webinar. We'll try to pick them up at the end of the session, and if we don't get a chance to address them then, we'll incorporate them into the frequently asked questions that will be sent round in the next few days. So I'm going to kick off and pose one question to Vashti or Nick. The first question's come in and it says, I can see the value of manuals, but are they a non-negotiable aspect of the Realising Ambition programme? I'll hand over to Nick.
Hi, this is Nick. It's a good question. And what I'd say is that they aren't essential. We're not saying that every Realising Ambition project has to produce a manual or an implementation handbook. However, we would strongly recommend it. We think the information that they contain is extremely useful, and certainly in terms of the Realising Ambition standards of evidence, which we've shared with you, and you'll have the opportunity to submit information indicating how your project is improving against those standards. We think a manual or an implementation handbook is a good way of pulling together evidence that your project is meeting the standards.
Thanks, Nick. Okay, we have had another question. This one says, I am implementing an evidence-based program off the shelf. It already has a developed manual. What do I need to do for Realising Ambition, if anything? I'll give that one to Vashti.
Great, thanks for that one. Well, we know we've got, I think, at least 10 programs in the Realising Ambition project overall that are replicating evidence-based programs from elsewhere, and the majority of these will already have a significant manual that's, you know, probably in your hands. Obviously, you don't need to rewrite that manual. That's there for you to use. What we would suggest is that you put together an implementation handbook that talks about, or that is explicit about, how that program is going to be implemented in your new context. So that would include any alterations that you're making to the target group. That might be that you're using a narrower age range. That might be the different processes that you're going to recruit, how you're going to recruit children and families. That might be different strategies you're going to use to retain them. You might also be using different referring agencies in the new context, and those would be things that you'd include in your implementation handbook. Of course, the costs of the program may be different in the new context, and you'd want to make that explicit as well. As Nick said in answer to the previous question, as part of the standards of evidence application within the Views platform, you'll have the opportunity to submit evidence against each of the different standards criteria, and we'll review those. So there may be things that you can use from the pre-existing manual, and there may be things that you need to create specific to the new context. Do we have another question, Sarah?
We do. Okay. I've got another question here. Oh, sorry, I've just lost it there. We've not started writing a manual yet, but we have lots of separate written pieces all in different places. Can we bring these together, or do we need to start from scratch? I think I can probably take that one, if that's okay. Yes, we would always encourage you to bring together documents that you've already written, and not to duplicate work that you've already completed on various bits of the manual. And the next section of the webinar that Nick will be leading will give you some ideas about a process that you might want to follow for bringing those documents together, and the process of developing manuals and handbooks. So hopefully we'll address that in a bit more detail in the next section of the webinar. We do have another question, and I will just read this one off the list. So, do you have any examples of good manuals? And I'll hand this one over to Nick.
Okay, thank you. Well, that's a good question. Some of the projects have already asked us about that, and we sent a couple of examples out. I think a really good place to look would be one of the clearinghouses of evidence-based programs that exists. It's called Blueprints. If you just Google Blueprints for Violence Prevention, you'll find a list of very good evidence-based programs, a range of them. Some are about parenting, some are more therapeutic programs, some are school-based programs, and there's about 30 listed on the Blueprints website, and all of them have manuals, and you'll be able to find on the Blueprints website contact information where you can find where to get the manuals from. So I think that's probably a good place to start. There are other clearinghouses of programs as well. So again, if you Google something like promising practices, or the Best Evidence Encyclopedia, which is more about education, or Child Trends Links, that's LINKS. Again, you'll find information about programs, and all of these programs will have manuals of some kind. So I hope that's helpful, and I'm going to see if we've got another question now.
Thanks, Nick. We do have another question. This one is, our intervention activities are designed very bespoke for the particular young person that we work with. It would be difficult for us to actually document this because it varies from young person to young person. How do we go about doing our manual? Who shall I give that one to? I'll pass that one over to Vashti.
Right, great, thank you. Well, we've certainly come across this when we've been providing intervention support to therapeutic interventions, where, of course, the nature of the intervention is that you're working with an individual's particular circumstances and particular presenting issues. And there's no way that a manual can list every potential problem or activity that may be undertaken with each individual that you encounter. I think where we want to get to, and some of this will come up in the logic model webinar, where we think, and the specifying program activities, where we think about what are the actual components and particular activities of your intervention or of your program. And where we want to get to is for you to be able to provide a generic statement about the strategies that you would employ, and then perhaps some concrete examples of what different activities would look like with different individual children. So it might be, for example, that I think we've had a project where they work on enhancing children's self-esteem, and that might be through doing different activities with young people that challenge their perceptions of themselves. So they might take them canoeing, they might take them hiking, all things that they perhaps didn't think they were able to do before, and by the end of it there's an impression that they've moved on and that they have greater self-esteem as a result. Now obviously we don't want to have to list all of the different activities that are possible there, but what you want to be able to say is something about the generic strategy of doing something with a young person that enhances their self-esteem, and some possible examples of what those activities might look like. So I hope that's been helpful in responding to that question.
Thanks, Vashti. The questions are coming in thick and fast now, so I don't think we're going to be able to get to everybody's, but I think we've got probably time for a couple, maybe 2 or 3 more. So the first one is, a couple of you have asked if we can send the links to child trends and the databases that Nick was talking about earlier. Yes, we will do that in our follow-up email that gives you the link to the webinar so you can watch it again if you've enjoyed it, or and also has the frequently asked questions in it. We've also had another question. Here we go. We already have a program manual and a generic implementation manual. As this is a pilot year, we were going to see what service adaptations will be used by our range of delivery partners, and then develop these ideas in an operations working group, who would then pull these adaptations together into, oh, I'm running out of screen, sorry, bear with me just a minute. Oh, here we go, into an implementation handbook style document. Does this seem sensible? I'll pass that over to Nick.
Yeah, I think that sounds a really good idea, and in the section I talk about, when I go through the process for writing a manual in a moment in a bit more detail, I'll certainly say that you want to, this is an iterative process, and it does make sense to revise manuals and implementation handbooks. We think that should be done on a regular basis anyway, perhaps every 6 months or annually, or maybe after each implementation of the program. And we think a useful way of keeping track of this is to just simply to number the versions. So if you make minor modifications, it might be version 1.1 or 1.2 or whatever. But then if you make a significant change to the intervention, you might want to make it or a significant change to the manual, you might want to make it version 2.0 and so on. So I'll talk in more detail about that, and we certainly think that it's very helpful to get input from a range of stakeholders. One of the things that this is very helpful with, I think, is ironing out contradictions or misunderstandings, and I'll talk a bit about that. And of course, as you flagged up in the question, there may be teething problems with the intervention. Things might need to change as a result of that. So I think what you're suggesting sounds a good idea.
Hopefully that addresses some of the other questions that have come in about whether once manuals are written, are they fixed or can we edit? So that leads nicely into that. And then finally, a last question. We've had a series of questions about whether you should document the kind of exact outcomes that are desired to be achieved from individual activities. So if you have a particular exercise, for example, around, we've been given an example here of a short cognitive behaviour therapy exercise, a CBT exercise. It's perhaps an hour long. The aim could be to elicit someone's thought processes and to explain the relationships between thoughts, feelings and actions. The outcome is more about the young person being better at positive self-talk. So I think this will probably, a couple of us will probably have some views on this, but you would have within the manual, you would have space for your logic model, which is essentially your theory of change. There will be a separate webinar on this topic, a couple of webinars down the line. And the logic model or the theory of change documents the risk and protective factors that your intervention targets and the outcomes that you want to achieve, and then it maps the specific activities of your intervention against those connections to illustrate how your intervention achieves the change that you want it to achieve. In terms of those very individual activities, I think that would come in your manual within your intervention content. Again, in the next section, Nick will be looking through what a manual might look like, the sections that you might want to incorporate. That will include a section on activities where you would document individual exercises where possible, what the aims of those are and how you go about them. I hope that addresses your question. I don't know, Nick, Vashti, whether you have anything to add. Okay, great. So I think it's time for us to move on now to our next input. I will just hand over to Nick in a moment and he will walk you through the second input.
Okay, thanks Sarah. Hi everyone. In the second part of the webinar, we're going to look at the structure of manuals and handbooks and how to go about writing them. So I want to take you first to a PDF document, and I'll just talk you through that briefly. So you should see coming up on your screen now a PDF document. With this has suggested sections for program manuals and implementation handbooks. So you can see down the left-hand side, in the left-hand column of that table, it lists the various sections that could be included in a program manual or implementation handbook, and it's over 2 pages. There are about 20 sections altogether. And then in the second column, you can see that we've annotated them to indicate whether they're relevant to a program manual, indicated by a PM, or an implementation handbook, IH, or both. For example, following the principle that Vashti set out earlier, that manuals should focus on aspects of a program that are unlikely to change, you can see that a manual would include sections on things like logic model, the research that underpins the program, outcomes, for example. Those things are unlikely to change whenever and wherever the program is implemented. However, there are other sections on things like potential demand, funding and marketing, which will vary from place to place, and we think that those things most usefully go in an implementation handbook, and you can see some of those on the second page. Program content and target group would always go into a program manual, but if these are changed in any way for a new setting, they would also need to go into an implementation handbook, and you can see those in the bottom half of the table on the first page, and that's where we've got PM/IH. This document also breaks down which sections of a manual or handbook are relevant for different stakeholders, and you can see we've listed across the top of the table those different groups, and then we've populated the table with text indicating what level of detail we think they need. And I would say there may be other groups you want to add, so for example referring agencies. The point we want to make is that these stakeholder groups don't all need the same level of detail on each section. For example, commissioners only need an overview of programme content, whereas of course frontline staff need to know the ins and outs of every session. Or to give another example, commissioners and managers need to know the detail of how a programme is funded, what the elements cost, and so on, but this needn't concern frontline staff. So there are merits to having different levels of detail for different audiences. It's worth saying a little more about each of the sections, starting with those that are only needed for a programme manual, which are indicated by PM in the second column. And you can see those at the top of the first page. So for example, history refers to how a programme came into being, for example, who developed it, where, when, and why. Just moving down, outcomes, risk and protective factors and logic model is exactly what it says. First, outcomes refer to the aspects of children's health and development that the programme seeks to prevent or address. Risk and protective factors means the factors that the programme tries to manipulate in order to achieve those outcomes. And a logic model is an explanation of why the programme activities will achieve the outcomes. Ideally, these elements would also be supported by 2 literature reviews. One of these would summarise evidence about the problem in question, including its prevalence and causes, for example, the proportion of children with conduct problems and how conduct problems arise. And the other literature review would draw together evidence supporting the programme's approach to preventing or addressing that problem. So to continue the example, it might summarise evidence that teaching parents parenting skills helps to improve their children's conduct. Then moving down the table, there are sections that are always needed in a programme manual and may be needed in an implementation handbook. For example, a manual should state whom the programme is intended for, in other words, its target group, but a handbook would need to say something about this if the target group was altered in any way. And a good example would be if a decision is taken to serve a narrower age range of children. Similarly, a programme should always detail the programme's activities, but if the programme is adapted in any way, whether those are surface or deep adaptations, as Vashti mentioned a moment ago, this needs to be flagged up, and it may also, of course, require producing some supplementary or replacement materials. Likewise, the manual should state the staffing requirements, for example, job descriptions, qualifications, training, and so on. And the handbook should show how this translates into a new setting. For example, how many staff are going to be employed. The same applies to fidelity monitoring procedures. Usually a manual should have these, but they may need to be adapted, for example, to piggyback on an existing quality assurance process. That's quite common. And then lastly, a manual should set out site readiness criteria, in other words, the characteristics of an organisation that's ready to implement the programme, but the handbook should demonstrate how these are fulfilled in practice. The remainder of the sections refer to content that would normally appear in an implementation handbook only. For example, potential demands would need to be based on a local analysis of the target group, and methods need to be worked out locally for marketing the programme, for example, to prevent potential referrers and recruiting and holding on to children and families who fit the target group criteria. Only someone who knows the local context is likely to be able to say how those things should be done. Then we've got data monitoring. This refers to data that's to be collected during programme delivery. It would typically include data on outcomes collected both before and after the programme, as well as data on the fidelity of delivery. And a budget is also needed. Of course, a manual should usually give some information about that. The programme developer or purveyor should say something about unit cost, the cost of materials, training, etc. But that needs translating into a budget for a particular implementation, and that should go into a handbook. I'm not going to go through the other sections. I think they're fairly self-explanatory. Okay, I'm going to go back to the the main presentation now. Okay. There are various methods for developing manuals and handbooks, but there are 3 phases to any method. First, some initial reconnaissance, second, collecting information, and third, drafting and finalising copy. And I'll go into those in a bit more detail in a moment. But I think to start with, it helps to start with a clear idea about the material you want to put together. And we hope that the PDF that I've just shared will help with that. We think that this will ensure that the process is reasonably structured, even if the detail necessarily varies from program to program. Another point is that program manuals would ideally be written before a program starts to be implemented. However, in reality, many programs already exist before a manual is pulled together. And this isn't necessarily a problem. The process is or should be iterative in the sense that there are likely to be several revisions of the document as the program is firmed up and articulated more tightly. And for this reason, we think it's important to keep successive versions of the documents and to log changes. An important question to think about at the start when you're writing a manual or handbook is this: who should I involve in writing the documents? A couple of things to say on that. First, it's a good idea to involve as many stakeholders as possible. Involve people in different capacities, for example, people who deliver the program, people who manage it, people who pay for it, people who receive it. In other words, frontline staff, trustees, managers, commissioners, or parents or families. The second thing to say is that you need someone who's a designated leader, a nominated person whose task is to coordinate the process and to write significant amounts of copy. In the case of a manual, this person should be an expert in the program and usually will be the program's developer. They understand the program's logic and the research and theory that underpin it, and they have an in-depth knowledge of its activities. This person may be different from the person who writes the handbook, which should be someone who understands the systems where the program will be delivered. And often, of course, this person will be a service manager. They know what the resources are that are available and the constraints and challenges that will be faced. So just to give an example, if you take something like the Incredible Years basic parenting program, and we might think that this is going to be implemented in a city's children's centres, let's say in Nottingham. The manual already exists. It's been written by the program developer, Carolyn Webster Stratton, who's an expert on children's conduct problems and how to prevent them. And she wrote most of the material for the sessions, so handouts, videos, etc. But the handbook would need to be written by a team in Nottingham, by some people who've got good knowledge of local families, children's centres, and local children's services. Okay, I'm moving to another slide now. This has a bit more detail on the process of writing a manual, and you can see on the left hand side it starts by agreeing what the manual outline is and then moves on to different people contributing and writing and editing of the sections. You can see there's a little feedback loop there because we want we anticipate that it will be necessary for some toing and froing to clarify points and so on. Then it should get sent out for comments to from different people, including hopefully an external expert and possibly some wider stakeholders. And then at the end, of course, the lead person will pull this all together. It's unlikely that writing a manual or handbook would need to start from scratch, and even for programs that are relatively new, written material is already likely to exist, and we obviously want to make good use of that. So it may be a case of assembling and editing together existing documents. A worthwhile first step then is to identify potentially relevant documents, and we suggest casting the net fairly widely here. You might look at notes or annual reports, presentations, slides, evaluations, maybe some initial program materials. And what you want to do is map out how these different things can contribute to the sections that I talked about earlier and are in the PDF. Even so, some additional information will need to be gathered. And this is likely to involve a mixture of the following: interviewing staff, observing the programme in action, searching the research literature, perhaps reading some case files if they exist, and conducting some focus groups with stakeholders. I've said the process should be iterative, so that areas of ambiguity or points of contradiction can be clarified. We think it's common in this area for different people to have a different idea about what the programme is, and it's not unusual for this process to expose some disagreement or a lack of clarity about, for example, what the target group is, or what the outcomes are, what the components are, and so on. And then the other thing to say here is that we think successive drafts of the manual or handbook will need to be shared and commented on. I guess another thing to say is that because these documents necessarily have a mixed audience, it makes sense that they are written in plain English, and that there is an assumption that the readers may be starting with different levels of understanding. So just to give an example, if you've got a logic model that's based on a cognitive behavioural approach, the text would need to explain in lay terms what this means. Or if a programme is targeted at children with conduct disorder, the person reading it needs to be helped to know what these children actually look like. And then I guess to help with this, a glossary is also likely to be helpful. So just going back to the previous slide, the flowchart, we think there should be an agreed process for writing drafts of the different sections and for receiving feedback and making revisions. And the more this can be spelled out at the beginning, the better. So this is obviously just a fairly basic structure, but you would want to flesh this out with dates for when different elements are going to be completed and who by. If any changes are to be made to the programme as designed, i.e. as it appears in the manual, then these should be made in close consultation with the programme developer. We want to stress that point. And then finally, the manual or handbook should be piloted with frontline staff delivering the programme. When you're working in the abstract, it's not always possible to think of everything, and so the kind of things you want to get answered at this point would be: does it include all the components and activities? Are there any materials missing? Is there enough detail? Is the language user-friendly and accessible? And all this, of course, is because ultimately we want to create documents that people will actually use. So that's the end of my input, and I'm going to hand back to Sarah, and we'll seek to answer any questions you have.
Hi there, thanks for all your questions that have come through. Please do feel free to keep on submitting. We've got a few minutes now to address some of these in turn. So I'll kick off with the first one. I'm in the middle of creating a manual for frontline staff. Would you say it is good practice to have in one manual rather than a separate programme manual and an implementation handbook? So I think that question is, would you have a programme manual and an implementation handbook for frontline staff? I'll give that one to Nick.
Okay, that's a good question. I think it's fine to have one big document, and we don't feel strongly about whether there's one document or two. I guess what you'd want to think about is how much of the information the frontline practitioners need. And going back to the PDF that I showed earlier, you'll see in that there are some areas where frontline staff need to have a lot of detail. So, for example, they need to know all the detail about the method of recruitment and method of recruiting participants to the programme. They need to know a lot of detail about the actual programme activities and the materials, but they only really need an overview of some of the other elements. So, for example, I don't think they would need to know in detail the research literature on the programme that's on the problem that's being targeted, or on why this particular approach is being taken to prevent or address it. Although, of course, they should have an overview of that because that's useful background information.
Thanks, Nick. The second question we've had says, will SRU help us to review and edit our manuals as part of the Realising Ambition? I can probably pick that one up. So all of the projects are being encouraged to submit information to the Standards of Evidence app, which should be coming online soon. Within the app, you're encouraged to upload information and documents that support how you meet specific criteria on the standards of evidence, and then the documents that are uploaded will be reviewed and edited at least, reviewed and commented on at least once by the intervention support team. So one option would be for you to submit manuals or handbooks as your supporting documentation. And then obviously there's also some bespoke support offered to each of the projects. And if manuals has come up as a particular priority within your diagnostic, then perhaps we would do some bespoke support to support you setting that process for developing the manual in motion. Yeah, so I think that answers that one, unless anyone else has anything to add. Okay, I'll move on to question 3. You mentioned that literature review should go in the manual. How do I go about doing a literature review? And I will hand that one over to Nick.
Okay, well, I think there are a few things to say about that. I guess first of all, you want to be very clear about the themes of the review. We think it's useful to split it into 2 parts. So the research into the nature of the problem that you're seeking to prevent or address. So the prevalence of that problem and the factors that are known to cause it. And then the second part would be focusing on literature about how that particular problem might be addressed. So I gave the example of conduct problems. In the first part, you'd want to find literature that says how do conduct problems arise in children, and in the second part, you'd want to do a review of strategies for preventing or addressing conduct problems, and which ones are most successful, and particularly focusing on the approach that you're taking. So that's just a general approach. I think then in terms of the nitty-gritty, you'd want to think about some of the keywords that you're looking to search by, and then there are various online search engines that we can point you towards. There are obviously books, some very good sort of overviews of particular areas that we can point you towards. So for example, if you're seeking to do something around preventing drug misuse, obviously there's a whole load written about that, but we can point you towards some really good summaries of that information. We think it makes sense as you're reading stuff to take structured notes, and would advise creating a very simple pro forma where you'd fill out one of those pro formas for every item you read, and then at the end you'd want to do some synthesis of the key messages, and we can, if necessary, provide some bespoke support around some of that.
Thanks, Nick. Okay, the next question I'm going to send to Vashti, and that is, how long should a manual be?
Important question for those of us given the task of writing them. I think we'll go back to the distinction between a program manual and the implementation handbook, because more often than not the program manual will be the longer document, given all the sections that Nick has outlined, that it's going to include things like the history, your logic model, the various literature reviews, and all the materials. It's likely to be a longer document. There's no specific target that you're working to. I think if you look at some of the manuals of model and promising programs on some of the clearinghouses that Nick's mentioned, you'll probably find on average they're somewhere between 50 and 100 pages. But some of the length will come from the materials. So those projects with lesson plans or a lot of written material, obviously that gets included in the program manual, and that can make it a longer document. For those of you who are using pre-existing manuals where you're replicating a program from elsewhere, then your implementation handbook will probably be a lot shorter than this. So yeah, the answer is there's no specific target you're heading to. but somewhere between 50 and 100 pages. And if you're doing a program manual, it's likely to be longer.
Okay, I think we've got time for one more question, and that's going to go to Nick, and it says, what should be included in the suggested evaluation plan section?
Okay, well, I guess the first thing to say about that is it depends on where the programme is at in terms of how much it's been evaluated to date, and we're strongly encouraging programmes to think very strategically about this. So some programmes, of course, have been very well evaluated already, and so the next evaluation would need to take the programme to another stage. Some are just starting out, and they need to kind of just maybe begin collecting some basic outcome data, and then later on progress to more rigorous evaluations, for example, with a comparison group or a control group in a randomised controlled trial. So that's the first thing to say. Just generally then, I think in an evaluation plan there are at least three things that you would want to say consistently. One is what the aim or purpose of the evaluation is, which might include the questions that you're seeking to answer. Secondly, of course, what data is going to be collected and how you're planning to do that. And that would include the measures that you're looking to include, and how you're going to apply those measures. Maybe you're going to do some observation, maybe some self-report by children or parents, maybe a teacher or practitioner completing something. There are various methods there, but those need to be articulated. And then thirdly, some sense of how the information is going to be analysed, and I guess fourth as well, how that information is going to be presented. So those would be some fairly basic things I think you'd always want to include in the evaluation plan.
Can I just add to that, Nick, that for those projects who will be put forward as part of the 4 projects that will be given a realising ambition more robust evaluation, so likely to be done by randomised control trial, we'll be working with them to do a separate plan for the evaluation that could be fed into this program manual, but we'll be working with them specifically to develop those evaluation plans. So if you've put yourself forward to be one of those 4 potential cases that get a robust evaluation, then there'll be some more support around that. I think we've come to the end of our time, and we want to give you a little bit of your lunch break, what's left of your lunch break. So we'll conclude the webinar there. We want to thank you for participating today, even though we can't hear your voices. It's been great to have your comments and your questions coming through. And as we said at the start, you can access a recorded version of this webinar. Laura sent to you earlier on today a PDF of the slideshow itself, the accompanying document that Nick's been referring to with the structure of the manuals and implementation handbooks, and we're going to develop a frequently asked question sheet based on the questions out of this webinar and ones that we haven't been able to get to. We really would also value your feedback on this webinar. This is the first time we're using this media to reach a lot of people, and we hope it's going to be a successful way of getting to many of you without us all having to be in the same room. So we'd value your feedback and thoughts on whether it's been useful and things that we could do to make it more useful in the future. Our next webinar on serving the right people is scheduled for November 29th, so I hope you've got that in your diaries. And of course, we look forward to meeting with you all face-to-face at one of our 4 regional meetings, and we're going to be sending more details about those shortly. So from Nick and from Sarah and from myself, thanks a lot again for participating, and we'll speak to you all soon. Thank you. Bye-bye.